Stop wasting money on shampoos and serums that only coat the surface of a dying problem. Here is what they are not telling you. A hormone called DHT, dihydrotestosterone, is quietly strangling your hair follicles from the inside, one by one, silently. And the products lining your bathroom shelf were never designed to stop it. Your follicles are not dead. They are suffocating. Hair thinning becomes more common with age, but it is not caused by a single factor, and there is no natural remedy that has been proven to reliably regrow large amounts of hair in everyone. If you're experiencing thinning hair after 60, it's important to understand what the evidence actually shows. Hair follicles are living structures that cycle through phases of growth, rest, and shedding. As we age, several changes can contribute to hair loss, including genetics, hormonal changes, inflammation, nutritional deficiencies, certain medication, medical conditions, and normal aging of the hair follicle itself. The most common cause of age-related hair thinning is androgenetic alopecia, also known as male or female pattern hair loss. In people who are genetically susceptible, hair follicles gradually become smaller over time. This process is influenced by hormones called androgens, particularly dihydrotestosterone, DHT, in men. In women, hormonal changes after menopause can also contribute to thinning. Before trying any treatment, it is important to recognize that not all hair loss is androgenetic alopecia. Conditions such as iron deficiency, thyroid disease, autoimmune disorders, scalp inflammation, severe illness, rapid weight loss, and medication side effects can all cause shedding. A dermatologist can help determine the cause.
Let's look at several commonly discussed treatments and what the evidence actually shows. Olive oil. Olive oil can help moisturize hair and reduce breakage in dry hair. However, there's no good clinical evidence that applying olive oil to the scalp increases hair growth or reverses androgenetic alopecia. Some people tolerate scalp oils well, while others may find that heavy oils worsen scalp irritation or seborrheic dermatitis. Olive oil should be viewed as a cosmetic conditioner rather than a hair loss treatment. Argan oil. Argan oil can improve the appearance and feel of hair by reducing dryness and breakage. It may make hair look healthier and shinier, but there is currently no strong evidence that argan oil regrows hair or prevents pattern hair loss. Like olive oil, it is best considered a hair care product rather than a treatment for follicle miniaturization. Peppermint oil. Peppermint oil gained attention after an animal study found increased hair growth in mice. However, animal studies do not necessarily translate to humans. At present, high-quality human clinical evidence for peppermint oil and hair regrowth remains limited. Some people enjoy the cooling sensation and scalp massage associated with its use, but it should not be considered a proven alternative to established treatments. If used, peppermint essential oil must always be diluted in a carrier oil, because undiluted essential oils can cause irritation or allergic reactions.
Rosemary oil. Rosemary oil is one of the most studied natural topical options for hair loss. A 2015 clinical trial compared rosemary oil with 2% minoxidil in people with androgenetic alopecia. After 6 months, both groups showed improvement in hair count, and there was no statistically significant difference between them. However, the study was relatively small, and it does not prove that rosemary oil is equal to minoxidil in all situations. Researchers do not fully understand how rosemary oil works. Proposed mechanisms include anti-inflammatory effects and possible improvements in scalp blood flow. Claims that rosemary oil has been definitively proven to block DHT in humans are not supported by strong clinical evidence. For people interested in natural approaches, rosemary oil is one of the more reasonable options to try, provided it is properly diluted and used consistently. Saw palmetto. Saw palmetto is often marketed as a natural DHT blocker. Some small studies suggest it may provide modest benefits for androgenetic alopecia, but the evidence is considerably weaker than for FDA-approved treatments, such as minoxidil and finasteride. The available research suggests that some people may experience improvement, but results are inconsistent and generally less dramatic than prescription therapies. Because saw palmetto may affect hormone-related pathways, anyone with hormone-sensitive medical conditions or those taking related medications should consult a healthcare professional before using it.
Pumpkin seed oil. Pumpkin seed oil has shown promising results in a small clinical trial involving men with androgenetic alopecia. Participants taking pumpkin seed oil experienced greater improvements in hair count compared with those taking placebo over 24 weeks. While encouraging, this was a relatively small study, and more research is needed before pumpkin seed oil can be considered an established treatment.
Current evidence-based treatments. When discussing hair regrowth, it is important to acknowledge the treatments with the strongest evidence. Topical minoxidil has decades of research supporting its ability to increase hair density and slow hair loss in many men and women with pattern hair loss. Low-dose oral minoxidil is increasingly used under medical supervision and has shown promising results. Finasteride is one of the most effective treatments for male pattern hair loss, although it is not appropriate for everyone and can cause side effects in some individuals. For women, treatment options may include topical minoxidil, oral minoxidil, spironolactone, or other therapies, depending on the cause of hair loss. A realistic 30-day plan. If you are concerned about hair thinning, take photographs of your hair under consistent lighting to track changes objectively. Schedule an evaluation with a dermatologist if hair loss is progressing. Consider proven treatments, such as minoxidil, if appropriate. If you prefer a natural adjunct, properly diluted rosemary oil is one of the more evidence-supported options. Maintain adequate protein intake and address any nutritional deficiencies. Manage scalp conditions, such as dandruff or seborrheic dermatitis, if present. Be patient. Hair growth is slow, and meaningful changes typically require at least 3 to 6 months. The most important thing to understand is that no oil, supplement, or shampoo has been proven to restore a full head of hair on its own. Some natural approaches show promise, but the strongest evidence still supports medical treatments, such as minoxidil and, when appropriate, finasteride. The goal is not to chase miracle cures, but to use approaches that are supported by the best available evidence.